Sacrum bone in X-ray under the supervision of Dr. Sadiq Al-Murshidi, prepared by student Teba Saad. The sacrum bone is not like the other bones in your spine. The sacrum, sometimes called the sacral vertebra or the sacral spine, is a large triangular bone intertwined between the hip bones and placed individually. And the sacrum and the coccyx are made of smaller bone that fuse, grow into a solid bone mass. Together by age 30, the sacrum is composed of 5 integral vertebrae, S1 to S5. Both structures carry weight and are integral with functions such as walking, standing, and sitting. The location of the sacrum at the junction of the spine and the pelvis mean that it plays a particularly important role for both the lower back and the hips. The sacral joints are the ones that carry weight and help stabilize this area of the spine. Like other levels of the spine, sacroiliac inflammation and dysfunction are two types of spinal disorder associated with the sacroiliac joint. The spinal nerve bundle in the sacrum are the sacral nerve called sacral plexus. The term of plexus simply means a network of nerve structures. In addition to the sacrum, together with the lumbar plexus, it creates a lumbosacral plexus. What is a pelvic X-ray? An X-ray is a common imaging test that has been used for decades that help doctors see the inside of the body without having to open it with surgery. X-ray imaging was published in 1896. Who discovered X-ray imaging? Taken by the anatomist Albert van Kolker's hand. In the ensuing 100 years, X-ray technology became stable. Today, various types of X-ray are available for specific purposes. A pelvic X-ray specifically focuses on the area between the hips, which contain many of genital and digestive system. Your pelvis is made up of 3 bones: a pubic bone, ilium bone, femur bone. Also for the hip joint and sacrum joint. Like all X-rays, this test uses a small amount of radiation, so it's generally not recommended for pregnant women or young children unless the risk of not taking it are greater than taking it. X-ray pelvis projections, anterior-posterior projection, inlet projection, outlet projection, Jaudet projection, flamingo projection. Pelvis anterior-posterior projection. The anterior-posterior pelvis view is a part of pelvic series examining the iliac crest, sacrum, proximal femur, pubis, ischium, and the great pelvic ring. It is a considerable importance in the management of severely injured patients presented to the emergency department. So, the patient position is in supine. 2. Lower limbs are internally rotated 50 to 25 from the hip. 3. Patient hands are out of the way of the imaging field. Thank you. Pelvis Jaudet projection. The oblique pelvis, otherwise known as the Jaudet view, is an additional projection to the pelvic series when there is a suspicion of an acetabular fracture. Geodet view is comprised of two projections. First, the iliac oblique for assessment of posterior column and anterior wall of acetabular. Secondly, the obturator oblique view demonstrating the anterior column of the pelvis along with the posterior wall of the acetabulum. Patient position. First, iliac oblique. Patient is supine. The unaffected side is rotated roughly 45-degree anterior, generally added with 45-degree sponge. It is available. The patient is central on the table and at no risk of overrolling. Second, obturator oblique. Patient is supine. The affected side is rotated roughly 45-degree anterior, generally aided with a 45 sponge. Ensure the patient is centrally on the table and at no risk of overrolling.